All right, so welcome to the Myositis Association. It's the Virginia, West Virginia, and North Carolina and Northeast support group on this evening. Thank you guys. We got some special guests that's going to be joining us on this evening. I'm not going to give it all away right away, but you will most definitely just sit back in your chairs and be ready to listen to some great speakers and experts on tonight, along with a dermatologist that's in the house on tonight. So thank you guys for joining. I most definitely want to start there. Give you a little bit of background about the Myositis Association. The Myositis Association mission is to improve the lives of persons that are affected with myositis, fund innovative research, and increase myositis awareness and advocacy. Our vision is a world without myositis. In the programming, we achieve our mission through a variety of services to the myositis community. So once again, thank you for joining us on tonight. And I must introduce myself. I started out, but I didn't say my name. So my name is Kanaya Gunter. I am the support group leader. I joined the Myositis Association in 2018. I am also a patient living with dermatomyositis since 2007. I wear a lot of hats. I'm a community health worker, nutrition health coach, and support group leader, which I'm very proud of to be on today. So thank you for joining, and we'll get started with the presentation. I do want to go over some rules, just a little bit of them, right? So while coming on in, be sure to mute your phones. And at the same time, with someone speaking or whatever like that, just hold on tight because we're going to be able to have some questions and some answers at the end. Okay, does that sound pretty good with everybody? Give me some thumbs up. So we'll get started. Let me share my screen. All right, and let me know if everybody sees it. Yep. All right. So at the very beginning, I might have missed it to tell you guys, but this meeting will be recorded. We're going to record at the beginning for our CSI Pharmacy team, and then we're going to stop the recording right before we get into our support group. All right, so welcome on this evening. We do have the clinical specialty infusion, immune globulin therapy, and myositis presentation, and this is through the CSI Pharmacy, and they just took the time out on this evening to come to present to us. So thank you, guys. All right, well, I'm going to start off by introducing Ms. Leslie Myers, clinical pharmacist. She's certified as far as a clinical pharmacist. She's an integrated clinical manager at CSI Pharmacy. Over 15 years of practice, experience in IG therapy. Wow. Committee member since 2019, board member with the I can't even see it. JA, I might be saying it wrong, Miss Leslie. Please forgive me, with the foundation. Frequent speaker at national and local conferences, and diverse experience in specialty home infusions from the pharmacy, the nursing, and payer perspective. So welcome, Miss Leslie.
Thank you. So tonight, just to open us up, I wanted to give you a little bit of history about CSI, and as we introduce our next two speakers, and just tell you a little bit about why CSI and how we established our vision and mission and what that really does to set us apart. We really aim to really transform specialty infusion and really set a new benchmark that provides a full circle support system for our physicians, our patients, and their overall care. So when we do this, we really aim to not only provide monitoring, but disease outcome measures. And by doing that, it really helps patients like yourself, diseases that have already been mentioned tonight, dermatomyositis. And when we do some of those outcomes monitoring, even through infusions in home care, that gives a feedback loop to the physicians, and helps really guide that therapy and patient response and really kind of take that to the next level. We have a huge dedication at CSI to patient advocacy. That includes local and national rare disease organizations and giving back, just like we are here tonight. And then most recently, really excited, we've done a cutting edge clinical research department. And what that does is we kind of look at IG, kind of where we are now and where it's going in the future, and looking at some clinical studies. And that can be as simple as asking patient questionnaires in the home or monitoring lab studies, and really just trying to shape where we are in this rare disease world, and where we want to go to really help patients improve their lives and their quality of life. And so you can see through CSI and this concept that was developed, we really have a very strong commitment to our patients, and really them being able to receive complete and comprehensive care. And we feel like that's the care they deserve each and every day. And I'd like to introduce our number one supporter, our CEO, James Sheets, the man, the myth, the legend, I like to say. Our next slide. He really is the brain behind, that CSI 360 program. And even before I joined CSI, I always looked up to James and what he was doing at CSI and how they take care of patients. It really is kind of next level. He is a board IG certified clinical pharmacist, founder and CEO of CSI Pharmacy with 20 plus years of practice in IG therapy. He and I sit on multiple IGNS committees together. He is on advisory board committees. And again, a lot of these are really what helps shape the world that we kind of work in these rare disease states to make it better for our patients. And each and every day, this looks very impressive, but I can promise you, James, he goes about this with patients at the forefront. Every day, just trying to make sure we remember why we do this and to keep patients and their care at the very front of our minds. And that's what keeps us going at CSI. And so with no more to say, I'd like to introduce James Sheets and take it from there.
All right, thank you, Leslie. Am I in control of the slides now, or?
I think Kanaya.
Perfect.
Mhm.
So yeah, thanks for the introduction, Leslie. That was really embarrassing, that man, the myth, the legend stuff. That's not
It's
true
true.
whatsoever.
I meant to say also most humble,
Yeah,
and
well,
that's one thing
yeah, and I've looked up to Leslie a long time, but I have the privilege tonight to introduce the real guest speaker for tonight, which we'll talk about here in a second. I just want to touch a little bit on myositis and on the community, and really what it's meant to us here at CSI. Um, I was first introduced to a patient rare disease group just a little over 10 years ago. And I was asked to go speak at one in Houston, Texas. It was a local support group. And I was excited, thinking, man, this will be great. I can go down there. I can share about IG therapy, which I've been involved with now for over 20 years, as you can tell by my white hair. And I was real excited about going to meet this patient group. And I show up thinking, man, I could really teach them a lot. And had this first meeting, and it turns out it was a myositis keeping in touch group, a support group, I'm sure, much like this in Houston, Texas. And I left there realizing a few things. One was that the community is incredible. Two was that I know very, very little about myositis and the disease, and that these patients really have to understand their disease and advocate for themselves. And so I left there really inspired about the patient community, really wanted to do something at CSI where we could help patients. So this isn't like an advertisement. This is just like, hey, we want to be here to help you if we can. And if we can't, we get it. No charge. Call us at any time. We're here just because we want to give back. And so there's a few things that we do, I think, that's really special for myositis and the community. For us, it really starts with, many of you patients may be on IG therapy and then had to fight your insurance company to get approval. And that's really what one of the original reasons why we were formed in the beginning is to help physicians and patients get the therapy authorized, because every insurance is a little bit different. So knowing how to navigate it whether that's writing a letter of medical necessity or helping our physician partners with scheduling peer-to-peers and with gathering the right clinical information to get those approvals. That is something that we can bring to help advocate for that patient. Helping patients with copay assistance. The medicines are so expensive. We have access to different manufacturer programs. We have access to different nonprofit groups. We have access to our own internal copay assistance program. So that's a big deal too, when you're faced with, if it's taking you a while to get a disease diagnosed, your doctor's found a treatment and it's $10,000 to cover your deductible. I don't know who can afford that. And so, finding ways to help get that covered so patients can get the care that they deserve is a big thing as well. And then from there, Leslie talked a little bit about kind of our clinical expertise, individualizing therapies, our infusion nursing, and the outcomes monitoring. This has been a really big deal for CSI in that patients, when you start on therapy, physicians want to know how you're doing. And they obviously come back, they see you on follow-up visits, and they can do their assessments. But in that middle time, if you're having reactions or the disease is not progress, or the treatment is not being too effective, the physician needs to know how that's going. And so we're able to help fill that gap with some objective information. And it's a big thing that we're really passionate about here. So, one's giving back to the community. We supported the Myositis Association now since 2017. We'll be at the annual patient conference. I hope you get to go. If so, please stop by and see us there. And then we love still to connect with some of the local support groups. We work with some of the nation's leading myositis centers, Johns Hopkins Myositis Center of Excellence, UPMC, physicians like Dr. Holcomb here, people who are really leading the research can trust CSI that we're going to take good care of their patients. And then finally, on the research side, because there is such a passion there, a lot of our projects are in that area. The first was looking at patient-reported outcomes in patients with myositis with a physician who specializes in myositis. And then right now, a big trial looking at IVIG in necrotizing autoimmune myopathy that we're partnering with a few centers as well as a manufacturer called Octapharma, who makes Octagam, to see if we can't help improve the ability for that to get covered. So we're excited about that, and just launched our latest one with another physician looking at dosing, different dosing options in myositis as well. So really love working with this group. If there's anything we can ever do to help, whether you're a patient of CSI or not, that doesn't matter. Email our advocacy department. Would love to help you if you've got a denial from your insurance company or whatever it may be. But to get to the real thing that you're here for, I want to introduce tonight's guest speaker, who graciously made time to do this for us. He's not associated with CSI. He is associated with Great Patient Care, but he was willing to come on and share a little bit about the disease with us. So excited about introducing a physician whose dedication really to patient care, academic excellence, and clinical leadership, it continues to really shape the field of autoimmune dermatology. And it's Dr. Zachary Holcomb. He's board-certified dermatologist, a native of Southwest Virginia. He brings decades of clinical experience to his leadership roles at Carilion Roanoke Memorial Hospital, where he serves as director of both the cutaneous autoimmune and connective tissue disease programs, as well as the dermatology inpatient service. He's a graduate of Duke University School of Medicine, and Dr. Holcomb completed his residency training that provided him with dual expertise in both rheumatology and dermatology. So he's highly skilled in diagnosing and treating complex autoimmune skin conditions, including dermatomyositis, lupus, and a range of connective tissue diseases. He's committed to medical education, has authored numerous textbook chapters and several peer-to-peer publications in some of the leading academic journals. So without further ado, it's my pleasure to introduce Dr. Holcomb.
Thank you so much, James and Leslie. That was too kind. It doesn't sound like you're talking about me, but I really appreciate the introduction there. And it's a pleasure to be here. Thanks to the CSI group and my colleagues there for inviting me, as well as Kanaya and our support group here. It truly is an honor to be able to speak to you guys tonight. And I'm really excited to sort of hear and learn from you more so than I am to really talk at this point. So I'll give you a bit of an overview and sort of what my practice looks like and my experience with myositis, For me, I'm a dermatologist at this point, so mostly that's dermatomyositis, kind of some of the work that we do with intravenous immunoglobulin and some other things. So I really appreciate the opportunity this evening. So this is where I'm located. We are in Roanoke, Virginia. If you guys are familiar with this area, I think on the next slide, I've got some pictures of beautiful Roanoke here. So we are sort of central to southwestern Virginia. We are affiliated with Virginia Tech and the Carilion Clinic campus. So my office is up here in the top photo there. That's our Riverside complex. And this is where we run our dermatology practice and where I see the majority of my patients with autoimmune connective tissue diseases. At this point, I've got about 70 patients as part of my practice with dermatomyositis. So it's an honor and a privilege to care for folks with that condition. And I know a lot of you guys probably have that here as well. I've already heard from Kanaya as one, and excited to kind of learn from you from a patient perspective. If we could go to next slide, please. So I gave a talk a couple months ago in Chicago at our AAD, or American Academy of Dermatology meeting, just about how we treat skin disease with dermatomyositis. As you guys probably know as well or better than I do, dermatomyositis is not just a skin condition, right? As a dermatologist, that's what I see. But we also very commonly treat patients with muscle involvement, lung involvement, associated cancers. Like this is a pretty complicated systemic process going on. So from a skin standpoint, that's a majority of what comes into my clinic. Here is sort of my disease ladder or my disease pyramid that I sort of treat different skin conditions or skin manifestations with. And you'll see right in the middle of that is intravenous immunoglobulin, or IVIG, which is one of the big things we're talking about tonight. So as you sort of build up from this, I'm not going to elaborate on it too much, but happy to answer questions about it. Almost every patient with dermatomyositis needs to be very strict about sun protection. We use topical anti-inflammatories, of course, and then pretty quickly we're reaching for systemic medications because, again, this is a systemic inflammatory condition, right? But if I could choose, in all honesty, what is the best thing on here for skin manifestation of dermatomyositis? It is IVIG. JAK inhibitors are the new kids on the block, and that's a pretty close second at this point. They do come with some immunosuppression and whatnot. But if I could get patients on IVIG, I would do it from the get-go. I feel like I'm honestly probably starting with methotrexate, mycophenolate, some of those more traditional immunosuppressants first because they've been around longer. They're easier to get approved. They're cheaper for patients, but IVIG works great for this condition. And obviously it's got the benefit of not being immunosuppressive as well. So we'll talk a little more about that as we go along. If we go next slide, please, Kanaya. My life got a million times easier a few years ago when we got FDA approval for intravenous immunoglobulin in dermatomyositis. This has made that approval process that James was talking about through your insurance companies 10 million times easier. It's still hard for patients with what we call amyopathic dermatomyositis, meaning they don't have the muscle involvement, just the skin involvement. But this does work well for both muscle and skin disease. And here's the big publication that came out in the New England Journal that sort of led to the FDA approval of the clinical trials with dermatomyositis and intravenous immunoglobulin. If we'll go to the next slide, please. So I got a lot of patients that have dermatomyositis, and some of them I manage together with rheumatology. Many of them we just sort of manage alone in our clinic. I did have 5 years of training through the Harvard Combined Program where I got to work with both dermatologists and rheumatologists. So do feel pretty comfortable with some of the medications that we use for this. This is my youngest patient with dermatomyositis. When I met him, he was 7 years old. And you guys can probably look at his pictures on the left and be like, okay, there's that sort of mid-facial rash, like kind of looks like the lupus butterfly rash, but not quite. You see his Gottron's papules, which is what we call the rash on the knuckles that he has there. And now if you look at him a year later, he is clear as can be. He's actually a little bit tan, so he's not really sun protecting as much as I'd like him to. But you can see how well he improved on just a couple medications, intravenous immunoglobulin and mycophenolate. So this is not an uncommon story for our patients. We see pediatric patients. I think my oldest patient with dermatomyositis currently is 89. So we see the full spectrum of patients and sort of manage both skin and muscle involvement with this. So really excited. I wish I had a bunch of pictures to show you, but I don't have a ton of patient permissions to show those. But this is not an uncommon story. When our patients go on this medication, we do try to get their skin perfectly clear. That's sort of our treatment goal. We go to the next slide, please. I think this is the end of it. So I am, again, located in Roanoke. I practice 4 days a week. I do see a lot of dermatomyositis and just general dermatology as well. I imagine most of you guys have a dermatologist and or rheumatologist, but if you, this is a bit selfish at this point, but if you are in the area or know somebody in the area or want another opinion or just need somebody to sort of see you and help manage through dermatomyositis, I'm always happy to see you guys. That's my work email there that you can email me questions or whatnot after the meeting. But it has been a pleasure to sort of be here and give an overview, and I'd be happy to sort of take questions with James and Leslie in our group at this point.
That's so impressive for that kid. I mean, that's life-changing for him to be able to, I mean, it makes me smile that he's a little tan, because imagine he wasn't doing fun things that would get him tan before, right?
I know. So dermatology has something called Camp Discovery for pediatric patients. It's quite interesting. A lot of these patients with these rare or what we call orphan skin conditions, they get together once a year at a summer camp, and they all get to meet each other. So he actually went to that. We got a lot of patients with sort of genetic congenital conditions, and his only requirement was he had to wear a lot of sunscreen, but he had a great time out there. So it was awesome.
Well, I just want to say thank you for that presentation. I guess I could start off, right, by asking a question. So sometimes we get a little bit confused, and then some of us do have, we're on a budget, right? So do you have SPFs or anything in your office, like samples that you would give away first, I guess, right?
Yes, we do. So these autoimmune skin conditions, dermatomyositis and lupus, you guys probably know, they are exquisitely sun sensitive, right? So our parking garage here in Roanoke is about a 2 or 3 minute walk from my office. And I'll tell patients, like, if you don't have sunscreen or a hat or whatnot on from that walk, like, that's too much sun exposure. And that is from sort of what we call the Fitzpatrick type 1 or very light pale skin to Fitzpatrick type 6 or much darker skin. Like, everybody is sun sensitive with these conditions. So I recommend very heavy sunscreen application, more so than I do my patients with melanoma and those sort of conditions. So I usually say SPF 50 or 70 if you can manage it. Sunscreens that are mineral tend to do better. So titanium or zinc-based sunscreens tend to do better. We do have some samples here in our office. The brand doesn't quite matter as much. I wouldn't go do something super expensive. I mean, your sort of basic like Neutrogenas and stuff that you can find at the grocery store or at your local pharmacy do pretty well. But SPF 50 and up, zinc or titanium tends to do best. And you get a lot of sun exposure that you don't think about in the car too. I mean, your windows, your windshield is not filtering out all your ultraviolet radiation. So I've had a bunch of patients who'll drive an hour to see me, and then they'll call me a week later and their hand rash or Gottron's is flared just from driving to the clinic. So little things you don't quite think about until you have to think about it, right?
Is there a number of SPF that, like, beyond that, you're kind of paying for extra and not getting it?
Yeah, I would say above 50 and 70, you're not getting much bang for your buck.
That's what I
At
thought.
that point, you're filtering out 99+% of your UV radiation. So probably not worth to go up to 100. At that point, it's going to be all chalky and pasty white anyway. So.
I have a question. Can you hear me?
We can hear you, yes.
I have IBM, and on both my arms, I get purple blotches that come and go. Purple blotches on my skin that come and go. What is that?
It's a great question. So I will be honest with you. I treat much less inclusion body myositis than I do dermatomyositis, because IBM tends to have less skin manifestations than dermato does. But a lot of times when you have these myositis conditions, your skin becomes much more fragile, sometimes from the condition itself, sometimes from like steroid therapy and things you've had. So your capillaries become quite fragile. I don't know if this is the case for you. I'm reaching a little bit here, but you can get a lot of what are called purpura or almost like bruises on the arms, just from the treatments you've had to go through. Sun exposure also makes that worse. It dissolves our collagen and elastic tissue and makes those sort of plump things surrounding the blood vessel is much more fragile. So again, hard for me to tell on a video without seeing your arms, but that's my guess as to what's going on.
Thank you.
All right. Looks like we have a few questions here. What can happen to a young adult if they choose not to take medications, biologics? What happens if myositis patients don't use sunscreen regularly?
These are great questions. James and Leslie, if you guys want to answer any of these questions in the chat, feel free. I don't want to sort of steal the whole thunder here. But I'll give you my take on dermatomyositis and myositis in general. So we see a full spectrum. And there are different things that I call like criteria to escalate therapy, things that you really have to treat or should treat. And then there are patients who sort of have a choice, right? Like how much does it bother you versus how much is the risk of taking the medication or the side effects of the medication bothersome to your life? So when we're talking about just skin stuff, you really don't always have to treat the skin. Most people want to, because dermatomyositis, it can burn when you're in the sunlight, but it is characteristically very, very itchy. I mean, we think about pain as being horrible in medicine, right? And like driving people crazy, but itch is right up there. Like if your scalp is itching from your dermatomyositis, if your face is burning, like that drives people crazy. And that is not a quality of life that most people want. So from a skin standpoint, we usually treat based on the symptoms. How bad is it bothering you? I've got a few patients, particularly those who have had it for decades, who do still have a little facial redness, who maybe get some Gottrins flaring in the summer, who decide not to treat it. They're like, the side effects of infusions or methotrexate or prednisone just makes me feel worse than the skin itself, and I'm okay. But the majority are going to want to treat it because the skin bothers you. The muscles are different. I mean, the muscles can be very life impacting and can be deadly if the inflammation is bad enough, right? So we almost always treat the muscles. My sort of soapbox here, dermatomyositis it bothers people incredibly, as you guys know, but it's one of the rare conditions in dermatology that we can actually cure. We know this mostly in our pediatric patients, but if you treat patients and get them into remission and sort of keep treating them in remission for a few years, there's a high chance that as you taper off those medications a few years down the road, the dermatomyositis does not come back. We see that less so in adults, but to a certain degree still in adults. I mean, if you can treat people and get the inflammation under control for 3, 4, 5 years, a lot of times if you taper off slowly, the condition stays under good control. So I think for me personally, like that is a strong motivation to treat. If I can meet a patient and say, hey, if you'll lean in and kind of stick with me for 3 or 4 or 5 years, like you may never have to deal with this again, like that's a chance that most people are willing to take. But it's hard, right? Because like we talked about in that big slide with the pyramid, like these medicines are not, mostly topical creams. We're talking pills, we're talking infusions. Like these are heavy hitter medicines that we got to do to shut the inflammation off. So sometimes it's hard for people to tolerate them.
Okay, where is the medical community in findings, both a cause and a cure for dermatomyositis?
We're not there. So dermatomyositis, to my understanding, autoimmune disease, your body has too much inflammation. That inflammation is attacking things it should not, like the skin, the muscle, the lungs, and some other things. And there are certain things we know that trigger that, right? So things that trigger it are things that rev up your inflammatory system. If you get a viral illness, it might flare or cause dermatomyositis. Sometimes certain vaccines will flare it up for people. We recommend you get them because they protect you from deadly illnesses, but a lot of times that will happen. Stress sometimes can flare it for people. Anything that kind of revs up your immune system can flare dermatomyositis. We don't quite know what causes it necessarily. But like I said, we are approaching what I would call almost a cure for this. I mean, it's almost like you're treating cancer or something, right? Like we're not treating this like I would psoriasis or eczema that says, hey, we manage it, and if you stop treating it, it comes back. We are treating with the intent to make it go away forever in the majority of cases. But that journey is not quick. There is no medicine we give you and a week later it's gone. I mean, that's a years-long journey. There's a lot of research going on. I know James and Leslie have talked to you a lot about sort of the patient outcomes and immunoglobulin research. There's more beyond that. If you guys, have other speakers or read about this, you'll see other medications that are in clinical trials. You'll see things like bone marrow transplants and what we call CAR T cell therapy. There's a lot of research going into dermatomyositis. And I think in 5 or 10 years, the treatment landscape may change because of some of that.
Hey, all. Listen, we have time for one more question for the doctor. And we can go ahead and take that now. So one more question for the doc. I appreciate it. Thank you, guys.
Okay, I have both DM and rosacea. Will IVIG also help my rosacea? I'm not sure which is which on my face.
It's a great, easy question. So the IVIG will not help the rosacea. So if you're getting better with IVIG, that's the dermatomyositis.
And then Lauren, if you don't mind, you can email Dr. Holcomb in regards to your appointment. I'm assuming you wanted to talk to him about your appointment.
Awesome. Thanks, Jess. And what we'll do, guys, is we are also going to take any questions that we did not get to. Kanaya will shoot us an email with those questions, and we promise to get those answered for you. You know, give us a couple, 3 days, and we'll make that happen for you. So again, thanks so much, Dr. Holcomb. Thank you for your time. Kanaya, thanks so much for allowing us to join your call. And we wish everyone the best of luck. And anything that we can do for you, we're here for.
All right, so that's the end of the presentation, and I want to most definitely say thank you guys for coming on out and speaking. It was excellent. You guys also asked some great questions for the doctors. Most definitely thank you. I do want to say this because we do have MyoCon that will be coming up the conference September the 18th through the 21st. So CSI Pharmacy will be there. So if you're already registered, you will be able to still see them in person and ask questions. And we will also have an excursion, which will be touring to their CSI corporate office. So come join us in MyoCon. And at the same time, they invited me to come be a speaker. Thank you guys for joining.
Kanaya, if I could, I wanted to say, I was not going to let you go without you mentioning the fact that you will be one of our special guest speakers at our facility there in Dallas, Texas. So guys, please register to come out for the excursion and spend some time with us, get to know us a little bit better, and hear the wonderful Kanaya and some other speakers speak at our corporate office. So hope to see you at the MyoCon excursion there in Dallas on the 18th.
Can I say something? Can somebody hear me?